This is your 2023 open enrollment. You guys have open enrollment basically for the next week. The email was sent out today, so if anybody does want to comment, if you've received the email through the EASE open enrollment system, you could type that in. I sent it out late morning, probably a little after 11 o'clock this morning. So hopefully people did get that, and that will be open for the next week. And the changes that you'll make now go into effect as of May 1st. So always keep that date in mind. And now is the time to make any changes. So I always put that in all caps because that's important to understand that now is the time to make changes. If you do not make changes now, you have to have a qualifying event throughout the year. And it looks like people are responding that they did receive the email, so that's good. But yes, you have to make your changes now unless you have a qualifying event, and you can do that throughout the year, but that's marriage, birth, death, divorce, change of job, status elsewhere, stuff like that. So it's more serious life events. I put at the bottom, log into EASE to complete your enrollment changes today. So that will show you your options and costs and all that stuff. And the email has already been sent out. Okay, as far as what's remaining the same and what's changing, the majority is remaining the same. We are staying with Consociate Health, and then kind of moving on down. I won't go through all those, but just point out HealthLink is the network that we've been using. AIM is a partnership to help guide you with care. I'll talk more about AIM in a little bit. BJC partnership, so that's Barnes and Wash U. We still have that partnership. And again, so on down, you can see. Moving over to the right here, SmithRx is still our pharmacy benefit manager. We changed to them, if you remember, last May. Things have been going well with SmithRx. There can be some additional steps with them that I will talk about later. But overall, the partnership has worked really well. No new ID cards will be sent out this year. So again, that's another one that's remaining the same. What is changing is the employee premiums. Got a slight increase for employee only and slight decreases for people with dependents on their plan. And then we're enhancing the relationship with AIM. We put here contact AIM in advance for anything more than a primary care office visit. Follow their guidance, and your deductible, coinsurance, and out-of-pocket can be waived. So I'll talk more about that in a bit, along with the Healthcare Blue Book partnership there at the bottom, in the bottom right corner. Okay, this is your summary of benefits that shows the deductible and the coinsurance, out-of-pocket maximum, copays, all this stuff. Nothing changed on here other than the fact that we added this little asterisk that gives you the ability to have your deductible and coinsurance waived. And you can see in red, new in 2023 down here at the bottom. Contact AIM in advance, follow their guidance to get your deductible and out-of-pocket maximum waived. So that's the only thing that changed on here. So we're excited about this. You guys have very good benefits in terms of deductible and coinsurance, copays, all that stuff. So to add a benefit that makes it more rich is impressive. I didn't think we'd be able to do that, but it is a good thing. So we will talk about that in depth when we get to the AIM slide. A few of the other things on here, I put on here just healthcare tips. We want people to call the doctor through Me MD. That can either be a call or a video or Skype, FaceTime, whatever you want to call it. But remember that is a free visit with a doctor, digitally or over the phone, and they can prescribe you medications. We put that as a $0 copay because we want people to use it. It's convenient. It's cheaper for everyone to use that benefit rather than going to the ER for non-emergency type things. So that's a reminder that Me MD is a benefit that we want to use. And then more on the left here, again, I won't go through all of these unless people have questions. But I just like to point out these things that, like on the bottom left corner here, it's common for there to be errors on healthcare bills. So examine them closely, ask for details, and you can always negotiate. So just remember this stuff. Healthcare, we have built a ridiculously complicated system that, in my opinion, is built that way on purpose to confuse people and to get them to not pay attention to their bills and just kind of, I would say, blindly, pay your bills, not ask questions. I don't like that. I despise the system in a lot of ways. And so that's why we want to try to fight back, whether it's healthcare in general or with pharmacy. That is why we partnered with Smith RX to fight back on what is, kind of big pharma and can be created to be not transparent at all and to confuse people and just end up charging a lot of money to you guys as the insured. So, and ultimately, it ends up costing the city and costing dollars that could be in your paycheck more. So that's why we put these partnerships in place, and we want people to pay attention to their bills and again, try to kind of fight back if you can, because there's a lot of things that were built not in your favor and built in the favor of, healthcare and pharmaceutical to profit. So keep that in mind. I would say I'm on you guys' side on this stuff because I see the issues with the system all the time. So from this page, though, just to kind of summarize, these are your benefits. They really haven't changed. You want to stay in network with HealthLink. If you are out of the area, you could go to an emergency room, and that would pay the same as your in-network benefits. But other than that, if you go out of network, it's going to cost you a lot more. So try to stay in network. Again, as a reminder, anybody can type questions in, but I'm going to skip to the next slide if we're good there. Not seeing any questions pop up. These are the partners that are still in place. I've already mentioned all those already, so I'll skip through that. As a reminder, Consociate Health, they are our third-party administrator. So this is just their hours of operation, 800 number, website, and then some reasons why you would call them. And here's more information on their website. AIM. Okay, so this is one I do want to spend a little bit of time on. AIM is a partnership that we put in place a couple of years ago, and as you can see on here, we put on here, they're your medical management or pre-certification partner. Some call them like a healthcare consultant or concierge service. I don't know, whatever you want to call them. I would just say they are put in place to give us a behind the curtains look at healthcare and the quality of care. We want people to call them. They have nurses and doctors on staff. We put do not rely on your physician, and that's specifically talking about for pre-certifications and stuff like that. We want you to get involved in your care from the beginning. So really anything more than a primary care office visit, I would call them. If you call them, they're going to help you get the right care at the right time, at the right place for the right price. And then we put on there again, the new in 2023, contact them in advance for anything more than a primary care office visit, follow their guidance, and you can get your deductible and your co-insurance waived. So this is a benefit that we know that if people will get AIM involved, AIM has the ability to see the quality scores of providers that our employees and dependents would have no idea of. So, and this is something that can be sticky with people because they may have a doctor that calls in and wants a certain procedure done or a certain kind of sequence of things done that may not be in the right order, or it may be too quick, or that doctor or specialist or surgeon may actually be ranked very low, or that hospital in general could be ranked very low. This is something I wish I could share more of, but I know doctors and hospitals would throw a fit. But we can see behind the scenes when a hospital has, maybe 50 specialists, we can see that maybe 20 of those are ranked in the red, meaning they're at a 25 or below, and maybe, another 15 or so maybe ranked in the yellow from a score of 25 to 75. And then it may only be a top certain percentage of those doctors or surgeons that are ranked in the green area, which would be 75 to 100. So this is a quality and rating system that is pretty advanced, and AIM pays a lot of money to have access to. And so we want people to get AIM involved because we know that they can get you to the right place to get your care done. So again, it's one that we know ticks some people off when AIM gets involved and you're wanting a pre-certification for a surgery because you think that is the right surgeon and it's the right doctor and all that, but there may be some more information behind the scenes that we hope people will realize. It's really good to have the city has invested in this and to give you guys access to that, because most people don't have access to this type of thing. For my own situation, my sister has really bad rheumatoid arthritis, thought she was going to have a spinal surgery. And she came to me because the surgeon that they had requested was the only surgeon that did this spinal surgery in the entire hospital system. And that surgeon ranked a 39 out of 100 and would have fallen in the lower half of the yellow. So I told her, no, don't go to that surgeon. Go to a different hospital system because that's the only one that they can refer you to within that hospital system. And they're going to keep you in that hospital system when they refer you. But I'm telling you, the quality scores aren't there. You got to find somewhere else to go. So you guys have that ability to do that type of due diligence beforehand if you will get AIM involved. And if you do get them involved, follow their guidance. Again, your deductible and your co-insurance can be waived. So we know that this will help people make better long-term healthcare decisions. The outcomes will be better. The cost is just a byproduct of a lot of that stuff. But the cost is also something that you don't have, or you haven't had the ability to do a lot of research on in the past, but we're trying to change that too. So, okay. Any questions on that? Again, you can type things in, or if you have general questions for people that joined later, this is recorded, so don't ask personal questions for any type of surgery or anything like that on this call. I will read, there's a question coming in, and if I think it's one I can answer to everybody on the recorded line. All right. Yeah, so the question, there's a question about imaging, and if it's at a freestanding facility that it is free, but if it's an emergency where that freestanding facility is not open, why would you be penalized for that situation? So the imaging services, what we're trying to do there is get people in non-emergent situations to use the freestanding facilities, because an imaging service that should cost $700 or $800, oftentimes at a hospital costs $4,000 on average. So in an emergency situation, if you have to have it done at an ER, we get it. Then it ends up going towards your deductible and co-insurance anyways. So it's a little bit different there in an emergency situation compared to the ones where you have some control on when it's scheduled, stuff like that. So hopefully that answers that question, but we're just trying to incentivize people to go to the right spot if you are scheduling it on your own rather than have it be an emergency situation. So good question there. Okay, I don't see any more questions at this point. I'm going to skip to the next slide. This talks about the AIM services that need to be pre-certified. So again, this is one that I know everybody gets upset when anything is added to the process and you have an extra step and all that. But trust me, there is such high misuse of healthcare that these steps are needed. I've had to go through a bunch of surgeries myself in my life, and I've had to go through some of these additional steps. So I get it when it's frustrating. However, we have to keep in mind that whether nonprofit or profit setup, hospitals and provider systems are there to make money. So there can be plenty of things that they may authorize or want done that we just need to pump the brakes a little bit and make sure it does need to be done. Your benefits are very good, at the city, and we want to keep them that way. And having these types of checks and balances in place is what really helps with that. So we want you to call in advance to go ahead and pre-certify these things. That's what we would encourage you to do. If you don't do it, the doctor or the doctor's office is required to. So we'd rather have you do it, and that way you can be educated. Because who knows, that doctor that you may be talking to may have data that shows that they love referring for surgeries or MRIs and CT scans, things like that, that maybe something could be done at a different facility, or again, maybe we need to pump the brakes a little bit. So, but these are the procedures that are put in the system to need to be pre-certified. Okay, this is a new benefit also. It's called Healthcare Blue Book. And Healthcare Blue Book is one that gives you the ability to really do a lot of the things that I talked about with AIM that you can have done, that you can get a look behind the curtains at pricing and quality ratings scores. But with Healthcare Blue Book, you can do it on your own. It's through our partnership with Consociate, which is our TPA. But with that partnership and with this added benefit, you can scan that QR code. And by the way, this document is in ease. So it does give you the ability to download it. And the QR code is on there, or you could call in or visit the website or whatever. But you want to download this, visit the website to be able to kind of look at those red, yellow, and green type provider rating systems and even see pricing on stuff. So this data is fascinating. I love it, maybe because I'm a dork to this stuff, but we hope people will use it, because you will realize that the pricing gap is insane in healthcare, because we've created a system, again, that is so complicated and so big and robust, and purposely not transparent, so that people won't do any of this due diligence on their own. So we're giving you the ability to do that. We hope people will use it. Let me know if people have questions on that, because that is a new one that, again, we are excited about. And go ahead and type things in if you need to. I'll watch that also. Okay, so the rest of this stuff is just kind of smooth sailing from here. A lot of the same information that you guys have already seen. So I will finish up quickly. But primary care network, or primary network, is still HealthLink. Open Access 3 is technically the name of it. The BJC Center of Excellence gives us a partnership with WashU and Barnes. And again, that's another one where if you go there for second opinion, or you end up getting referred there, you can end up getting your deductible and coinsurance waived there also. The last part is the Wrap and Travel Network. That's PHCS. That wraps around our HealthLink network, since HealthLink is more of a regionalized network. So that's one that is used kind of nationwide. And no matter what, at the bottom we put in there, you always want to ensure that your provider's in network, especially if you're going somewhere for the first time. This talks more about the Barnes partnership that I've already mentioned. So when to contact them for second opinions, or if hospital and specialist medical care is not available locally, more expert guidance, diagnosis, treatment for complex situations. And if so, your deductible and out-of-pocket can be waived. The logo is on your ID card, so you have the information there too. SmithRx. So this is worth another reminder. On the next two slides here, it talks about our pharmacy benefit manager. Man, it seems like I'm bashing the system a lot here, and yeah, I am, because the system is frustrating. But pharmaceutical is one that is another area that people get gypped on all the time. I'll give a quick example just to humor myself, I guess, because it feels like I'm kind of talking to a blank screen here. But there are prescriptions that come out that are not necessary. They are for pharmaceutical companies to profit off of people, and you would have no idea the prescription is, worthless or overpriced or whatever. Duexis is my most recent example that I give for people. but Duexis is a prescription that is made up of 2 over-the-counters in ibuprofen and Pepcid AC. So for people who have, maybe some arthritis pain or whatever, joint pain, and need ibuprofen, but they also have, acid reflux, heartburn, whatever you want to call it, and they use Pepcid AC, the manufacturer decided to make this so convenient for the for users to be able to just take 1 prescription instead of 2 over the counter, and the price tag for that could be $2,000 to $3,000 per month. Or it could be a couple months dose, but still, for something that should cost $20 to $30 to charge, $2,000 or $3,000 is just another example of one of the tricks that are played on consumers in this country with our pharmaceutical system that is messed up in a lot of ways. So we partnered with SmithRx to keep that stuff from happening and to get you guys to be able to get prescriptions at a lower cost. The next slide here shows the Connect programs, and these are ones that can be confusing. They can add a few more steps to the process, but they will help you and the city overall. So trust me, they're worth it if SmithRx reaches out to you. And it's the same with AIM from my earlier slides. If AIM reaches out to you, please take their call. Please respond to them. SmithRx is the one that they've got a patient assistance program. For an example at the top there, you can end up getting approved, and there takes some paperwork and some processes to get this, but you can end up getting approved to get a very expensive medication, a specialty medication that may cost 50 grand, 100 grand. I just did one earlier today that's $165,000 per year for a person to be on. And that $165,000 medication could be one that you could get for free if you will work with Smith and get approved through the financial programs to get it directly from the manufacturer. So we want people to know about those programs and respond to SmithRx because they're set up to help you guys. And to help the city overall, which again is good for everybody. And we're trying to reduce this because we would much rather have this type of thing go towards you guys as, payroll and other programs rather than to big pharma or healthcare. So the question came in, how do I get a copy of these slides? I don't think these are in Ease yet, but I will make sure these are in the Ease online enrollment system after this, and they may even already be in there right now, but I'll make sure they're in there so you can have a copy of these slides. Good question, good reminder for me. Okay. Telemedicine, I already talked about that, but just remember you've got a free telemedicine benefit 24/7, 365 for your non-emergent type things. You can call in and you can even get a prescription. They say 60 to 70% of the things that people go to urgent care or an ER for could probably be taken care of over the phone. And last estimate I saw was 500,000 doctors short in this country to really keep up. So this is a very efficient way to get healthcare, get access to healthcare that helps with that issue. Average wait time is usually about 10 minutes instead of waiting, days or hours or whatever in some of the other options that you guys have. Dental benefits and vision benefits did not change, so I'm not going to spend any time on those. I say they didn't change. The benefits themselves didn't change. The cost of the dental went up a little bit. The vision stayed the same. And that's it. Thank you. I will keep an eye on the questions here. And I tell you what, I will stop recording in just a minute also. But thank you to everyone who's been on this or everybody who is listening to the recording. I'm with Diamond Brothers, and we appreciate your business very much. Enjoy working with the team there at Carbondale, and I always enjoy the employee meetings and these types of meetings as well. So thank you.